that one because we dropped it.
We're gonna demonstrate this here, the pain, stomach.
We did that over here,
Can you hold it?
down there. We're going to actually needle these.
Oh,
Yeah, we're just going to
The
demonstrate
clavicle.
these clavicle points.
so this is a local treatment then?
No, this is just to demonstrate the points.
Oh, to
So he doesn't
demonstrate.
have,
Oh,
so,
okay.
so this area we're using to treat pubic symphysis, right? We're using it to treat inguinal ligament. It's just happens to be, since we were up here talking about all these channels, I thought we'd just demonstrate these
Okay.
points right here. So just for demonstration purposes, not that he needs them.
So
Guinea
this
pig,
is
yeah.
for, you said again, for inguinal pain?
Inguinal ligament, right? So inguinal ligament runs from ASIS to the pubic symphysis. So ASIS is coracoid process here, and it runs, so we're basically mirroring coracoid process and inguinal ligament running all the way to pubic symphysis here, and then pubic tubercle at the manubrium. So pubic symphysis at the sternoclavicular joint, manubrium is going to be pubic tubercle, at the sternoclavicular joint, pubic symphysis at the manubrium. So on the jugular notch there. So we're going to look for, we're trying to needle into this subclavius, which is beneath the clavicle, under clavicle, between the clavicle and the first rib. So we're going to start at the kidney 27 location. And we're just kind of angling up and under clavicle. Is that okay? Nice. See that? It just kind of goes along, almost along the edge of the clavicle, but kind of up and under.
It definitely got into a spot that's where I usually feel the tightness. Actually, kind of radiated to my arm, left arm.
And that one, I want the angle a little farther, so there it goes, right? So they're fairly transverse, right? But they're up and under, right? So we're between the first rib and the clavicle, so we're actually safe, right? Lung is coming up, apex over here somewhere. So we're safe in this location where this muscle, we just follow this clavicle along. So you might need 2 or 3 or 4, we'll do 3, to release that inguinal. If it's tight, it'll be tight and tender and achy, right? Thank you for holding the shirt back.
And this would release the inguinal on the same side?
Inguinal,
or
opposite side. Yeah, opposite side, opposite side. Yep, that's good. And sometimes we'll need we'll just do one more just to demonstrate. So at the sternoclavicular joint, it's a whole joint space here, right? So we can be on this side of the joint, we can be under the joint. This one's going that direction. If they're having a pain at pubic tubercle, many things are inserting here at the sternoclavicular joint, so we can kneel around this. I usually don't go above it, but I'll go on the inside and around that joint space. So we're going to go we're going to go from here and go up a little bit. So we're going to kind of angle around this joint space a little bit this way, just like that. And so we're kind of running into where the joints are meeting. That's kind of what I'm looking for. And we can let that go under if we want, and it'll just lie flat. Since the needle's so flat, it just lies flat like that. See how I got all nice and red there? That's the erythema from the needle reacting with the location. We also palpated it quite a bit, but I think the erythema of the needle is actually reacting there. So we're getting a good response on that spot, and that'll release that pubic tubercle spot. So where gracilis is inserting, right? Some of the adductors are inserting there. That's a tender location.